And we're live in 5, 4, 3, 2. Even as America begins to reopen, people across city neighborhoods continue to express appreciation for the healthcare workers braving hospitals to treat COVID-19. Similar to the firefighters who sacrificed their lives during 9/11, frontline healthcare workers have become symbolic heroes of the moment. But for many American healthcare workers, this time is unprecedented in terms of the ways in which their lives are threatened. Nurses expressed appreciation regarding the community responses, but also felt a lot of stigma as potential disease carriers. The public kept saying, "Oh, nurses are heroes, doctors are heroes, they're doing so much for us." You're out in Scrubs, and they're like, "They're contaminated, get them away. They're infectious." We keep indoors. When we dare to venture out, we are cautious. Our neighbors smile, but in their eyes there is reserve and suspicion. They keep their distance, as we do ours, in mute accord. As we descend the downward slope of COVID-19, we need to remember that our healthcare workers are still important. During the height of the pandemic through March to June, there was widespread media coverage and thanking our healthcare workers with mosaics and murals and songs. Everyone appreciated them. However, as we descend the downward slope, our appreciation for our healthcare workers also declines. However, these people deserve our thanks because while they are heroes, they are human. They are as frightened as we are. And we need to remember that these people matter even when we think we don't need them, because they're risking their lives every day to help us. So, articles from The Intelligencer, The Conversation, The New York Times, and The Washington Post have been woven with a poem from CNN to create a program dedicated to our healthcare workers. Because without them, where would we be? From the moment he wakes up, Peter Shearer, the chief medical officer at Mount Sinai Hospital in Brooklyn, spends his day thinking about coronavirus. Like every other hospital in the city, Shearer's ER and ICU are now inundated with COVID-positive patients. Shearer knows this is only the beginning, and so he and his Mount Sinai colleagues have agreed to keep us updated on life inside the hospital. This is the first dispatch. The number of very sick COVID patients coming in is tremendous. It's a little scary. We have 220 beds and we've planned for a surge up to 240 to 260. And they're sick. The patients are so sick. We probably have 5 COVID deaths a day or more now. It was a really sudden ramp up with increasing numbers of patients. They were getting sick and getting admitted, and the beds were filling up, and patients were just crashing on the floor. Let me pull up my mortality report from yesterday. I haven't seen it yet. So 10 people died yesterday. You know, I've cried in stairwells and hallways. Life is fragile, and it could be any of us. It could be any of us. There are days that I'm convinced I'm going to get it and I'm going to die, but I think it's a little more emotional than scientific. We started putting bodies in the morgue truck last week, and it's been used a lot. I think we have about 40 bodies in there now. We had to outfit it with shelves because you have to keep track of people. You have to make sure the right family gets the right body back. I have a COVID positive 41-year-old patient who just died about 5 minutes ago. I just got the message. I don't know how long I can keep doing this. In my mind, I'm gonna do it. I'm gonna be here until the end. But it's gonna be real hard to come back to work after this is all over. Much of our fear is unspoken, for there is at last the weight of custom, the tender of rote consolation. We endure thoughts of demise and measure the distance of death, but death, too, wears a mask. I remember this woman in her 50s. She came into the emergency room. I tried to reach her family, but when I connected, I only had bad news for them. As I stood in my protective spacesuit of gear, holding my phone out to this woman so that her daughter might see her again. This is what death has become. I couldn't help but overhear. Mommy, please come back. Please. Alex Ingham is an ICU nurse based in Texas who came to New York to volunteer during the COVID crisis. As an Army veteran, Ingham is used to dealing with trauma, but she had never experienced anything quite like this. Her dispatch. There was one really bad day, April 12th. We were trying to keep this one patient alive who'd been dying all night. And then she was coding. We made it a short code not to be cruel, and then a next door neighbor coded. I run in and I take over chest compressions. And in the ICU, they'll set up an iPad on a tripod so that the family could see the patient. And I run in and I hit the iPad and it falls facing the wall, but finally they call the code. Time of death. I walk back around and then I see the iPad on the floor. And I realize the family's still on there. I'm like, shit, it's still on. The doctor sees and then he goes over and gives the bad news, and I can just hear him screaming. Wailing over FaceTime. When I go into these rooms, I'm thinking to myself, am I the last face these patients are seeing? I'm sorry, it's me. I found myself asking God to forgive me. I shouldn't be the last person they see. The worst night I had was in the emergency room. I intubated one person and I look to my left and I see this woman. She's all curled up and I can hear her breathing. She's next. I go to the head of the bed and I'm getting ready as she's in cardiac arrest and I was so taken aback. She had these stunning blue eyes. And I'm thinking to myself, she's looking at me and I'm looking at her, and this is it. Her eyes should have been looking at her husband or kids. I intubated her and she didn't make it. You know, I don't want to play God. I thought my job as a physician was to do no harm. We can determine who we are in our essential nature and who we can be. We are committed to this end for our own sake and for the sake of those who will come after us. There is a better future, and we can secure it. Let us take up the task, and let us be worthy of our best destiny.